Today was the first episode of our, of the program, the talk on dementia, and I think in this very first episode, we've been able to address some of the most important questions. And I really hope that our viewers, especially people watching this session in Pakistan, would be able to know that this is something that needs to be, we need to pay attention to, because as you mentioned, a very great point, that unfortunately it's really sad that people in Pakistan tend to ignore, the symptoms of dementia. They don't talk about it. They keep this issue hidden, and as a result, people are not able to, administer the kind of caregiving that is needed. They're not able to provide the kind of care, the kind of the quality of care that you must provide to your loved ones who are suffering from dementia. And when I look at people, people, when I meet people, and when I get to find out that they have relatives who are suffering from dementia, it's really sad, because people want to know, but they don't have access. And as you mentioned, we don't have data, and that is one of the reasons why, the cause of dementia and the way to deal with dementia is a limitation here. So I think this is a great opportunity. All the information you shared is an exceptional, source, and I really hope that our viewers. I think she has a question.
Yeah. Sir, as you discussed, there is no data about the patients of dementia in Pakistan. What can we do to, as our higher authorities like Health Ministry and Prime Minister, pay attention towards this problem, because it is a big disease, and we should have a data about this disease.
Yes. So I think the way the data can be collected is that we do have death registers, and so we should start recording the cause of death registry, and that would start giving us some idea of how many people are dying with dementia. The second way of is that there are dementia clinics starting in different areas, and as dementia clinics start developing, they should start collecting information on how many patients are coming through during every day and every week. And that would start giving us an idea of how many patients are being referred to us. So because it is, we don't have universal healthcare in Pakistan, but the the Prime Minister has announced a lot of support for the different parts of the country where free health funding is available now to spend. So people should ask for help with dementia. They should start recording that information. How many people are helped through that new health system? Health, I think there is a health card now, isn't it? A health insurance card. So part of that, we can start collecting data, because data is the power. If you have good data, you can direct your resources towards that. We've always um, 12 years ago, I was instrumental here in my city, Nottingham, to redesign fall services. And the first thing we did was started collecting how many patients come through the emergency department with a fall. And that data was collected through ambulance crews and through admission units. And we were able to show that X number of people are coming every week, and if you changed and invested into these things, this number would decrease by this and save so much money. So at the end of the day, it is how in Western countries we decide how to spend money, but in Pakistan, I think it will be how to uh, use how to develop resources, because at the moment, like you've told and I've researched Pakistan, we do not have enough memory services. Somebody else raised a hand.
Thank you so much, sir.
Yes, sir. The question I have is on in that you have mentioned blood supply is one of the reason for dementia. So we know that in Pakistan, blood pressure is the major or very common reason that prevails in the families, right? So, what do you suggest to keep blood supply, to keep check on your blood supply to your brain because it leads towards the dementia? And if you want to take care of our initial, for this problem, that it isn't progressing into the very chronic disease.
Thank you, Zainab. I will we will discuss all the treatment options in another program, but I'd like to say here is that blood pressure management is dependent on people. So every person who has hypertension should have a blood pressure monitor, and they check their blood pressure regularly. And once you start doing that, then you will be able to talk to your primary care physician or general practitioner or specialist, whoever you go to, and give them an idea of this is my blood pressure in the morning, in the afternoon, in the evening, and this is the effect of my medication. And the other problem with the medication is that medication in Pakistan is quite expensive. So people take when they can. And so one of the things that we need to address through at a government level, federal government level, is to try and negotiate the price of um, hypertension and diabetes medication lower, because overall their benefit would be immense to reduce the burden of um, advanced disease. Somebody else had a hand up. Hafiza Hira, you have a hand up.
No, no, sir.
Okay.
Previously, raised the hand.
Okay. Right. I think it's 1 hour nearly.
Yeah, I guess this has been a great question answer session so far. And sir, thank you so much, for giving us all the time despite your busy schedule. You collaborated with us for this session, and you've shared excellent piece of information with us. Thank you so much, and we look forward to having you once again, inshallah, in the next episodes.
Thank you.
So we're going to end the session here. Thank you, sir. Have a great day. Stay safe. Allah Hafiz.